Globally, over 8 million people die from smoking-related illnesses each year, according to the World Health Organization (WHO). This number includes over 7 million deaths from direct tobacco use and roughly 1.3 million deaths from secondhand smoke. In the past 10 years, an estimated 70 million people have died worldwide from tobacco use. In the past 10 years, an estimated 3.8 million people have died in armed conflicts, wars globally. In the past 10 years, smoking was 18 times more lethal than armed conflicts. Cigarettes cause more deaths than cocaine, automobile accidents, AIDS, alcohol consumption, heroin, fires, suicides, and homicides combined. Because nicotine is highly addictive, it substantially weakens a person's free will to quit smoking. The majority of regular smokers want to quit for health and financial reasons, but are unable because of nicotine's addictive power. The smoker becomes so enslaved by this powerful addiction that breaking free becomes extremely difficult. According to statistical studies, 60% of smokers begin by the age of 14 years, and 90% of smokers are strongly addicted before reaching the age of 19. These people are enslaved by nicotine addiction for an entire lifetime. Without a doubt, the metaphorical chains of addiction are very real. Despite the obvious addictive powers of cigarettes and the many diseases they cause, big tobacco spends tens of billions of US dollars annually on advertising, promotion, and sponsorship worldwide. Smoking tobacco is a significant risk factor for various diseases, including cancers, cardiovascular diseases, and lung diseases. The vast majority of these millions of people who died by smoking this highly addictive product did not die quickly and painlessly. They died slowly and painfully, being consciously aware of their deteriorating health and looming death. Cancer kills you slowly, especially if it spreads to other parts of the body. Cancerous tumors can grow aggressively and invade your nearby tissues, blocking blood vessels or pressing on and damaging organs that are essential for keeping you alive, such as the heart, lungs, brain, kidneys, or liver. When cancer cells spread from their initial location to other parts of your body, this is called metastasis. They can invade and destroy healthy tissue and disrupt the function of your vital organs, like the lungs, liver, and brain. Cancer in your digestive system can block the movement of food, leading to malnutrition and vomiting. Tumors in your lungs can block airways or destroy healthy lung tissue, making breathing difficult and leading to a lack of oxygen. Here is a list of diseases and illnesses related to cigarette smoking: lung cancer, acute myeloid leukemia, bladder cancer, cervical cancer, colorectal cancer, esophageal cancer, kidney cancer, throat cancer, rectum cancer, mouth cancer, liver cancer, pancreas cancer, pulmonary fibrosis, emphysema, chronic bronchitis, type 2 diabetes, a weakened immune function, asthma, heart disease, stroke and heart attack, dementia, eye problems such as cataracts and macular degeneration, rheumatoid arthritis, fertility problems for both females and males, gum disease, and serious pregnancy complications. Cigarette smoking doesn't just harm the lungs, it also harms nearly every organ of the body. Is big tobacco an evil entity? Well, does the desire to feel pleasure from inflicting pain or death, or both, on someone a requirement for an act or a person to be categorized as being evil? Certainly not. For example, a husband or wife who fatally poisons his or her spouse in order to collect a $1 million insurance policy is not motivated by gaining pleasure from this evil act. The administering of the poison is a means to an end, collecting the money. Likewise, the manufacturing and selling of addictive products, cigarettes, to people with the knowledge that it will significantly increase the risk of getting one or more of the aforementioned diseases, which will in many cases cause suffering and death, is a means to an end, a financial profit. Although the pleasure element is missing here, it's still evil. In Indonesia, children 8 to 10 years old have been getting sick working on tobacco farms. There are more than 500,000 tobacco farms in Indonesia. Almost all of them are family owned. Some of the symptoms that Indonesian children experience while handling tobacco, a highly toxic substance, are dizziness, coughing, and shortness of breath. The children absorb nicotine, the world's most addictive and dangerous drug, through their skin when handling the tobacco leaves on these farms. These children are literally poisoned not only by the nicotine, but also by the pesticides that are extensively used on tobacco farms because they inhale the pesticide fumes. Many of the children are also exposed to passive smoking from inhaling the fumes released during the tobacco curing process. Long-term exposure to the nicotine, pesticides, and tobacco curing process fumes will very likely increase the children's risk of getting acute intoxication symptoms like irritation, headache, dizziness, peripheral neuropathy, and potential long-term effects such as Parkinson's disease and other neurodegenerative disorders such as dementia when they get older. As Indonesia's tobacco production industry continues to thrive with laws which greatly favor big tobacco, an increase in the production of cigarettes becomes almost inevitable. An increase in production means a corresponding increase in the number of Indonesia's poor children becoming addicted to nicotine. This will in turn lead to an increase in smoking-related illnesses like stroke, heart disease, emphysema, lung scarring, cancer, etc., and deaths. And the cost on Indonesia's social health insurance industry will continue to overburden the country. According to Dr. Hasbullah Thabrani, professor of health, economic, and policy, when the young generation of Indonesians become addicted, big tobacco will continue to profit for the next 30 to 40 years. And that's obvious from Big Tobacco's marketing strategy, as they have been targeting the youth of Indonesia. This means that up to 50% of these smokers will eventually die from smoking-related illnesses unless they manage to quit, which is very, very difficult to do because of nicotine's addictive power. According to statistical studies, anywhere from 71 million to 120 million people in Indonesia smoke.